So dear friends, welcome all. Today we are going to start a course that is the diploma in acupressure. So there are many questions in the last few days. Many participants were asking what we are going to learn in this course. हम इस कोर्स में क्या सीखेंगे? पहले मैं बताऊं इस कोर्स की जो लैंग्वेज होगी वो होगी हिंदी एंड इंग्लिश. The language of this course will be Hindi and English. This course is approved by NSDC. I will give you the link in the group and anyone can ask me that link and you can see the validity of this course. All the pages you will find here to see the validity. आपको एक मैं लिंक दूंगा जिसमें आप इसकी validity को भी चेक कर सकते हैं. In this, it's very clearly mentioned what is the NSDC certificate. NSDC means National Skill Development Corporation. So it's very clearly mentioned here, the Skill Development Corporation is an autonomous body and by the Ministry of Skill Development and the Government of India, right? And this certification are accepted by the various government agencies. So this is as a proof of your skills and the qualification. तो इस सर्टिफिकेट की वैल्यू है ना, इट्स अ वेरी डिफिकल्ट टास्क by the government side to do all the courses, because in India there is no acupuncture university till now. There is no acupressure university till now, and it has become very difficult by the government to create lots of employment in various fields. कई सारी fields में employment create करना it's very difficult task by the government. तो इसके लिए they are giving this to many bodies who can conduct this course. So this course, it's very clearly mentioned here. So this course is providing you one certification. After the completion of this course, we will be taking one exam. That exam will be based on what we are learning for this training program. अभी हम ट्रेनिंग में जो कुछ सीखेंगे उसके बेस पर ही हमारा एग्जाम होगा. Your skill always matter. Even you do this course, like even someone is doing MBA, but there is a campus interview, right? So the company are checking the caliber of the student. तो इवन अगर आप ये कोर्स कर भी लेते हो लेकिन आपका एक इंडिविजुअल स्किल भी होता है कि आपने सिर्फ कोर्स फॉर्मेलिटी के लिए किया कि आपने ढंग से किया. इस बात के ऊपर ये वेरी करता है कि आपके लिए कितनी अपॉर्चुनिटीज ओपन होंगी. So you might get many opportunity. It depends on your skill also. So NSDC also improving their standards, because sometimes the many person are getting NSDC certificate and they are not having enough skill. It is same with the person who is doing MBA from some university and is not having enough skill. So in this way, the NSDC also updating the standards. NSDC is the organization established by Government of India. In India, if we talk about the two places like Maharashtra and Kolkata, ये दो जगह में तो काउंसिल है. लाइक कोलकाता में तो बहुत समय से है और महाराष्ट्र में भी बनी है. So you have to follow the rules and the regulation given by the council, and that all the rules regulation given on the website. But if we talk about the all other states, there is a no council formed till now. अभी तो कोई काउंसिल का निर्माण नहीं हुआ है. तो जब काउंसिल का निर्माण नहीं हुआ है and you want some certification, you want some certificate, so you have some options and NSDC is the one of the very good option. तो कई लोगों ने प्रश्न पूछा इसमें कैसा सर्टिफिकेट मिलेगा. अब हम आपको सर्टिफिकेट भी मैं दिखा रहा हूँ कैसा सर्टिफिकेट मिलेगा. आफ्टर कंप्लीशन this types of the mark sheet will be given and this type of the certificate will be given. Okay. अब this certificate is not designed by us. ये सर्टिफिकेट हमने नहीं बनाया. कई लोग बोलते हैं सर्टिफिकेट में कुछ और अच्छी डिजाइन होना चाहिए, बट दैट इज नॉट इन आवर हैंड, राइट. डिजाइन इज नॉट हैविंग एनी. हमें एक अच्छा सर्टिफिकेट चाहिए. ओके. डिजाइन इज नॉट मैटर, राइट. तो ये सर्टिफिकेट मिलेगा. कई लोगों ने प्रश्न पूछे मुझे कि कैसा सर्टिफिकेट होगा. सो दिस इज द सर्टिफिकेट. इन दिस कोर्स we are going to discuss many common diseases. We already have mentioned in the WhatsApp messages like general health, pain relief, mental health, sleep, weight loss, skin and beauty, digestion, women health, migraine, many specialized conditions and many more. So we will be taking many classes. This course will be only on the weekend, Friday, Saturday, Sunday. The timing will be 8 p.m. and this course will go near about 3 months. We will also provide the recording. हम recording provide करेंगे. So if anyone missed the course, can see the recording. After the completion of the exam, after completion of this course, you have to appear in one exam. It will be a very simple exam. As per our previous experience, 100% student got passed in our previous exam also. We have done wellness acupuncturist, master wellness acupuncturist, 100% student passed. But suppose because of some reason, if someone is not able to pass, he will get again. He has to pay some examination fees, some 1,500 rupees or so, and can appear in exam again. No need to pay entire fees again. So whenever we are doing acupressure, जब हम acupressure करते हैं, तो क्या लगता है कि अगर हमारा mindset सही नहीं, हम सही acupressure कर सकते हैं? अगर no, our mindset should be very good because we are having stressful, we are having irritability, we are having some aggression. We can't do a good acupressure. So first step, guideline for therapist, that we have to tune our channels and energy. हमें अपने channels को tune करना. In the Ayurveda also it's mentioned. Ayurveda में clearly mentioned है. Every Ayurveda doctor has to take 10 days leave every year and doing the worship of Lord Dhanvantri, doing the fasting, doing the lots of chantings, and just doing cleansing, like mental cleansing, and the cleansing of the heart. तो आयुर्वेदा में है ही कि आपको हर साल अपने हार्ट की क्लींजिंग करना चाहिए. Otherwise, what will happen? I will tell you, when I started my career, I was very happy, very smiley, very jolly, very, very smiley. Every patient used to like me. But after the 5 years of practice, I become always irritable. If someone is asking any questions 3 times, oh, why are you asking this question again and again? Then I realize this might happen with anyone. ये किसी के साथ भी हो सकता है. जब हम अपनी प्रैक्टिस स्टार्ट करते हैं, हम खाली होते हैं. But with the time, our heart is getting filled with lots of stress, lots of anxiety, lots of emotions and all. And we become irritable. So it's a mandatory to clean our heart time to time. अपने हार्ट को समय समय पर क्लीन करना बहुत जरूरी है. Not only hearts, our heart, our mind. So in the acupressure, there are very wonderful 5 point has been mentioned, and it's a very necessary. Every therapist should stimulate for self-healing. The point number 1 is pericardium 6 and the point number 2, heart 7. These 2 points are very important point. We already know. The pericardium 6 and the heart 7 also are the very good point to improve relationship. You know, this is the pericardium 6 here. Just keep the 3 finger from the wrist crease and coming here. This pericardium 6 is very good point to improve the relationship between 2 friends, relationship between the 2 politicians, 2 kings, husband, wife, and between 2 persons. With the help of these points, pericardium 6, we can improve the relationship. In the Yellow Emperor book, it is very clearly mentioned about this. Stimulate this point to improve the relationship between 2 kings. The second point is heart 7 here. ये हमारा heart 7 point है. So we have to press this point on the wrist crease. This is the second point. It will calm down our heart because heart 7 is also called spirit gate. We can see here the name of the heart 7 is spirit gate. Look at here. So the inner gate, the pericardium 6, and this is the spirit gate. With the help of these 2 points, we can calm down our heart. And as we calm down our heart, means we will calm down our mind and we will calm down our brain with the help of these 2 points. Now the next point is governing vessel 24.5. This is nothing but third eye. ये हमारा थर्ड आई का पॉइंट है. So third eye is the very important point here. When we are angry, the energy from the third eye is start flowing down. नीचे की ओर एनर्जी जाती है जब भी हम गुस्सा होते हैं, जब हम एंग्री होते हैं. But when we are having good energy status, the energy from the third eye moving upward. That's why we put the tilak like this. We never put the tilak like this. We want to lift the energy, so we are putting the tilak like this. So this is our third number point, or we are telling DU 24.5. Because DU 24 is here, DU 25 is here. ये हमारे 2 पॉइंट हैं, DU 24 एंड DU 25. इनके मध्य में यह है बिंदु है, इसका नाम है DU 24.5. Excellent point for relieving all the unwanted stress, frustration and worry. क्या वीडियो हैंग हो रहा है? इस वीडियो इज हैंगिंग? No. So the next point, LI4. LI4 is a very famous point. Why the LI4 is very good point? We can see here. This is the location of LI4. The LI4 is the source point of large intestine. ये हमारे large intestine का source point है. LI4 is like a blower. Blower जानते हैं आप? Blower का मतलब है कि वो जो जिससे हवा निकलती है. We can clean the window and all with the help of blower. The air is coming out. With the pressure of the air, we can clean all the areas. So LI4 is like a blower. If you stimulate the LI4, it will start the good flow of the energy and it will clean all the meridian, will remove all the blockage from each and every meridian. LI4 हमारे प्रत्येक मेरिडियन को क्लीन करने की क्षमता रखता है. Right? That's why LI4 is a analgesic point. LI4 को हम पेन किलर पॉइंट भी कहते हैं. What is the meaning of pain killer point? The pain killer point who remove the blockage, because meaning of pain, the energy is blocked. If the energy blocked in the lower back, we will feel lower back pain. Energy blocked in the neck, we will feel neck pain. Energy blocked in the knee area, we will feel knee pain. जहां भी ऊर्जा ब्लॉक होगी वहां का पेन होगा. LI4 is the source point, work like a blower, remove all the dust. पूरी गंदगी को, धूल को उड़ाने की क्षमता रखता है. LI4 सारे मेरिडियन को साफ कर देता है. इसीलिए LI4 is the fourth point everyone should stimulate. The next and the last point here, spleen 6. ये हमारा spleen 6 point है. We can see here. It is one of the great point, spleen 6. Why the spleen 6 is great point? If you see most of the intellectual person, जितने भी intellectual person हैं, they are having spleen deficiency. उनके अंदर spleen deficient मिलेगी आपको. Why? Because spleen is becoming deficient if you have worry. अगर आप worry करते हैं, if you think a lot, then your spleen will become weak. आपकी spleen कमजोर हो जाएगी. You will see most of the intellectual person, चाहे वो डॉक्टर हैं, चाहे वो एक्यूपंक्चरिस्ट हैं, या और किसी फील्ड के जो लोग हैं जो बहुत ज्यादा दिमाग का यूज करते हैं, उनका स्प्लीन कमजोर मिलेगा आपको ज्यादातर. So as a doctor, as a therapist, if we want to do our self healing, we have to protect our spleen. Otherwise, after the practice of few years, definitely spleen is going to become weak. So there are 5 points we have discussed. हमने इन 5 पॉइंट के बारे में डिस्कशन किया. ये जो 5 पॉइंट हैं, इन्हें प्रतिदिन एक हीलर को एक्यूप्रेशर करना चाहिए. So they will be having very good, like, pain free body. So this will create pain free body. It will cool down the heart. This will also cool down the heart and brain. It will bring a wonderful awareness, concentration. ये हमारा थर्ड आई पॉइंट. ये हमारे अंदर अवेयरनेस लेके आएगा. एंड इट विल स्ट्रेंथन योर स्प्लीन. एंड इफ स्प्लीन इज गुड, यू आर हैविंग वंडरफुल मेमोरी. अगर आपकी स्प्लीन अच्छी होगी तो आपकी एकाग्रता बहुत अच्छी होगी. ओके. सो क्विकली आई विल शेयर द लोकेशन ऑफ दिस ऑल द पॉइंट्स. एक बार मैं आप तुरंत इसकी लोकेशन शो कर देता हूं. So the point number 1 is pericardium 6. So look at in this image. So the pericardium 6 is the point here. It is a 3 finger away from the wrist और 2 चुन away from the wrist. हमारी कलाई से ये 2 फिंगर, ये 3 फिंगर या 2 चुन की दूरी पर होता है. राइट. So this is the point number 1. So we have to praise this point. We will shortly praise this point and we have to make some precaution. The median nerve is passing from here. Median nerve. हमारी median nerve पास होती है. And when the median nerve is getting compressed, then the person is having wrist pain. And if the median nerve is getting compressed, there is one disease that is called carpal tunnel syndrome. जब मीडियन नर्व कंप्रेस हो जाती है तो एक बीमारी होती है जिसका नाम है CTS और कार्पल टनल सिंड्रोम. So median nerve is passing from here. So when we are pressing this point, we have to do the gentle acupressure. We don't have to do very vigorous acupressure. हमें बहुत ही gentle acupressure करना होगा. If you are doing very vigorous acupressure on this point, you might feel tingling sensation in the middle finger. अगर आपने बहुत तेज दबा दिया इस पॉइंट को तो आपको मिडिल फिंगर में से टिंगलिंग सा फील होगा. सो दिस इज आवर फर्स्ट पॉइंट फ्रॉम द wrist crease going 3 finger or the 2 chun proximal, and this is the location of point. We can press this point with the help of thumb pad. हमें thumb pad की मदद से पॉइंट को प्रेस करना है. Avoid using thumb tip. Okay, because thumb tip might give very vigorous pressure and will create some pain sensation, unwanted pain sensation. So we are keeping the thumb pad here. Then we are doing acupressure 1, 2, very gentle acupressure here, 3, 4, 5. In this way, we have to do acupressure here 20 times. मास्टर टूम कहते हैं, मास्टर टूम का कहना है कि अगर यहां ना करना हो तो चलेगा, यहां भी कर सकते हो, थोड़ा यहां भी कर सकते हो. You can perform the acupressure. If you don't want to do here, you can do here, or you can do here, little here and there, but you don't miss the line. So I have made one device for that. I will show you. ये मैंने एक device बनवाई है. It's a wonderful device, especially for the patient who are very scared with the acupuncture. So what we have to do, we can keep on the pericardium meridian like this and just do 100 times. 1, 2, 3, 4. Make sure you are doing gently. If the person is feeling some tingling sensation here, avoid that much pressure. We can use this device at many points. I was inspired with the master tone. Now the second point is heart 7 here. हमारा अगला point है heart 7 यहाँ पर. So quickly we'll see the location of heart 7. So in this image we can see this is the heart 7 here. We can feel the, okay, this is on the wrist crease on the small finger side. This is the point. Okay, the third point will be spleen 6. Spleen 6 is the point located on the leg. This is the point, wonderful point to improve the spleen. Why the spleen 6 is good point? Because the 3 meridian are crossing this point. हमारे पैर में 3 ही meridian होते हैं yin के. All the 3 meridian like the liver meridian, spleen meridian, the kidney meridian crossing the spleen 6. So as you stimulate the spleen 6, you are strengthening the liver, you are working on the spleen, and you are also tonifying the kidney. So that's why spleen 6 is a very good point to strengthen your kidney, spleen, and the liver. So this is our next point. And Li4 is the point located on the dorsal palm. We can see here. So this is the location of Li4. It's a very easy to locate this point. We can feel the muscle belly here. So this is the muscle belly. On the tip of the muscle belly, we will find this point, Li4, or it is called painkiller point. Okay. So we have understood the points for self-healing. Okay, so Li4 is here. So pericardium 6, heart 7, Li4. Pericardium 6, heart 7, Li4. 3 point here, 3 point here. Then third eye.
Large intestine.
Then spleen 6 in the feet. Done. Let's move ahead for the next. अब हम आगे बढ़ते हैं. So we have seen the point for self-healing here. Some summary is given. So I will be giving this PDF. You can see later on. So the step for tuning self-energy. Now, very important thing, if the therapist, still we are not treating the patient, अभी भी हमने patient को treat करना चालू नहीं किया है. Still we are working on the therapist. Okay. If the therapist having irritability issue, getting irritable very fast, then use the 4 gate point. Because 4 gate points are the very good point. They will balance your emotions. Why we get irritability? हमें irritability क्यों होती है? अगर हम बात में क्यों चिढ़ जाते हैं? If someone is asking some questions, suddenly we get irritated because of some emotional issues. In the acupuncture, we are telling it liver chi stagnation, कि liver chi suppress हो गई है. आपके अंदर इतना स्ट्रेस इकट्ठा हो गया ना कि अब आपकी liver chi suppress हो चुकी है. In that condition, the very wonderful point Li4 here and the liver 3 here, with the help of these 2 points, we can release the unwanted gathering of the emotions stored in our heart. So these points are called 4 gate. इन पॉइंट को हम 4 गेट कहते हैं. जैसे एक डैम है, डैम में पानी ज्यादा भर गया है, तो गेट खोल दिए तो पानी निकल जाएगा और डैम कि टूटने का खतरा टल जाएगा। डैम के ऊपर जो ओवरलेड आ रहा था वो टल जाएगा। ठीक उसी प्रकार से फोरगेट की मदद से हम अपने हार्ट को और लिवर को, अपनी माइंड को, के इमोशंस को बाहर निकाल देते हैं। सो वी कैन एक्सपेल अवर इमोशंस, अनवांटेड इरिटेबिलिटी, एंगर, स्ट्रेस with the help of these forget points. Forget points are very good for many things, but there are three main things. Number one, they're the very good point for relieving the pain. अगर दर्द है किसी भी प्रकार का, they are very good point forget. Second, it's a very good for irritability, stress, anxiety, चिड़चिड़ेपन को कम करते हैं. And third, they're the very good point for digestion. Okay. So these are the indication of forget points. Now, work for therapist is over. Now we will be coming to the patient. So do you think that it's necessary to heal the therapist or not? क्या आपको लगता है कि एक थेरेपिस्ट को हील होना जरूरी है? Yes, it's very much necessary. Right? Yeah. So now we are moving to the patient. अब हम patient की बात करते हैं. Right? So for any patient, in the acupressure, we start first treatment same, whether the migraine headache or the menstrual pain or the knee pain or the Parkinson. The first step will be same, which I'm going to show right now. The second step will be different. सेकेंड स्टेप अलग अलग होगा. जिसको माइग्रेन होगा उसे माइग्रेन के पॉइंट्स लगेंगे, जिसे बीपी होगा उसे बीपी के पॉइंट्स लगेंगे. सो द स्टेप नंबर वन, दैट इज कॉल्ड द ट्रीटमेंट ऑफ मास्टर की पॉइंट. मास्टर की पॉइंट, इट्स अ वंडरफुल पॉइंट. मास्टर की, व्हाट इज द मीनिंग ऑफ मास्टर की? मास्टर की क्या होती है? एक ऐसी चाबी जिसे सारे दरवाजे खुलते हैं, उसे कहते हैं मास्टर की. द की विच कैन ओपन ऑल द डोर्स. Okay, that is called master key. So we are starting the treatment with a master key point. For this, how will be doing the treatment? I will just tell you here. We have to do the treatment on atlanto-occipital joint. हमें ट्रीटमेंट कहाँ करना है? हमें ट्रीटमेंट करना है atlanto-occipital joint पर. ये कहाँ होता है atlanto-occipital joint? Let's see here. So the meaning of atlanto, the first is cervical. Atlanto का मतलब है हमारी पहली cervical vertebra. So we can see here, this is the C1. The name of this vertebra is atlas. And this is occiput. ये हमारा occiput bone है. And the junction of this area, this is the occiput. And this is the atlas. So this is the junction of head and neck. ये हमारे head and neck का junction है. This area. We are having some master key point here. हमारे यहाँ पर master key point है. So we are having master key point upper body here, and here also we have master key point of lower body. यहीं पर हमारी master key point upper body भी है और the master key point of lower body भी है, right? This is a very important area, and we have to do the decompression. यहाँ पर हमें क्या करना है? यहाँ पर हमें करना है decompression. The meaning of this, we have to remove the compression. We are having some muscles here. यहाँ पर हमारी कुछ मसल पाई जाती है. तो we have to release these muscles. हमें इन muscles को release करने की जरूरत है, right? So let's see here once again. We are working on the suboccipital area. हम इस suboccipital area पर work कर रहे हैं. So here These are the various muscles here. We are working on this area. So occiput and atlas at the junction of atlanto-occipital joint, this called suboccipital release. इस एरिया को रिलीज करना. So when we are doing the release of this area, only we don't do in one condition. हम केवल एक condition में नहीं करते. If the patient is having low BP, then we don't do this. बाकी सारी कंडीशन में हम कर सकते हैं. तो क्वेश्चन आता है फिर लो बीपी वालों को क्या करें? That is the next step. What to do for low BP? That is the next step. Question number 2. Yes, it's true. We can't do for low BP, but you can do with a precaution. If the low BP patient is, if you can check the BP and do the treatment. Because why we don't do for low BP patient? Because as soon as you do this, it will calm down the nervous system and relax the body, and even it will work on the blood pressure. If the person is having high BP, it's a wonderful suboccipital release. बहुत शानदार है. कैसे करना? I will show you the demo. So in the scalp acupuncture, we have discussed this sometime, and the difference between the master key point of upper body and the lower body is very minimal. बहुत कम होता है. I will show you here. See that. So quickly, I will show you. Am I audible? Yeah. So I will hold the skull like this. You can see here. यहाँ पर मैं skull को ऐसे hold करूँगा. Okay. And again, I am telling you a word if the person is having low BP, or you can do with the precaution. आप precaution के साथ कर सकते हैं. So here it's mentioned the master key point of upper body and the master key point of the lower body. These 2 points are located on this area. Got it? So let's do the demo. Give me 1 minute only. Okay, now you can see the model. So first I will show you here. Tell the patient lie down very comfortably. Okay. And I'm turning the head so that I can show you. So we can see this is the ending of occiput. Okay. So this is the ending of occiput and starting of cervical here. Okay. I will do on the junction. So this is the ending of occiput, and this is starting of cervical here. I will do in the junction. So I will keep my both hands like this. मेरे दोनों हाथों को मैं ऐसे रखूं. I will keep my both hands. Okay. See those now? So now I will keep my hand like this. So first I will keep my both hands just like this. This is the step number 1. I'm keeping here. Okay. You have to guide the patient. आपको patient को बोलना है कि leave the 100% weight on your hand. अपने सिर को होल्ड करके ना रखिए. Okay. I'm keeping my hands here very comfortably. I don't have to do anything for 1 minute. Just have to hold this. I can rest my thumb on the back side of the ear. कान के पीछे मैं अपने अंगूठे पे रख दूंगा. This is step number 1. As near about 1 minute over, and I'm feeling some softening. यहाँ पर मुझे कुछ softening लगने लगी. So the step number 2, then I will bend my finger a little. And I will keep my finger at the junction of occiput and cervical. Key step number 2 होगा. So you can see here, I'm just keeping my hand very comfortably after 1 minute. Now I am bending my finger. So I am bending my finger like this, right? Step number 2. Now step number 3. I will take the entire weight of the head on my finger. Now I will not keep the head here. Entire weight I will take here. This step number 3. Then I can penetrate more. पूरा वजन अब फिंगर पे ले लूंगा, लेकिन we have to do this process slowly. पहले हमें मसल को रिलीज करना है और फिर धीरे धीरे हमें इस पोजीशन में आना है. So the step number 3. Step number 1, keeping the hand gently. Step number 2, pointing the finger upward. And step number 3, taking entire weight on my finger. आप अपने सिर को मत उठाइए, नीचे छोड़ दीजिए सिर. Keep your head weight completely on the bed. Don't lift your head. Okay. So step number 1, keeping my hand there. Step number 2, pointing my finger. Step number 3, taking the entire weight on my finger. And the final step, near about 2 minutes are over. इतने प्रोसेस में लगभग 2 या 3 मिनट ओवर हो जाते हैं. Now what I will do, the step number final, I am like this. Now I will close my elbow near to each other. अब मैं अपने elbow के पास में. As I bring my elbow near, my finger will be separated. So this is the wonderful stimulation of the master key point or suboccipital release. ये बहुत ही शानदार stimulation. So as I'm doing this, I'm bringing my elbow near to each other. So it will get separated. This is the final step. Yeah, this is the final step. Wrist and elbow both coming to here. Okay. Step number 1, keeping my hand comfortably. Step number 2, pointing my finger upward. अपने सिर को मत उठाइए. Step number 3, taking the entire weight of the head on my finger. And we have to do very slowly, near about already 2 minutes or 3 minutes over. And the step number 4, bringing my wrist or the elbow near to each other, separating my fingers. I will spend 4 to 5 minutes in this. Now, very important task. इसके बाद, when I will complete, I will be coming back very slowly, very slow, very gently. Resting my finger for some time, then gently removing my hand. What's the benefit of this process? इस प्रोसेस का क्या बेनिफिट है? The number one, it will release our vagus nerve, which is coming to your heart, which is coming to your digestive part. Person will feel very calming effect in the heart and improve digestion, improving the liver, improving all the organs in the abdominal cavity and the chest cavity. Wonderful activation of vagus nerve. Second, this is a very good area to expel the bind. ये बहुत सुंदर एरिया है बिंड को एक्सपेल करने का. So if the person is having headache, we will feel the tightness in this area. So as we do this, we will release the unwanted tightness and improve the headache. Because after that, in the next class, our topic will be neck pain and the headache. That time also we will do this with some other points. But I told you, this is the master key point we have to do for everyone. हमें सबके लिए करना है. कोई भी patient, whether patient is coming for the knee pain, I will tell you, if you do this for the patient suffering with the Parkinson, you will be surprised. Sometimes tremors will reduce just within 5 minutes. 5 minutes में. It's a very effective. But it might not happen with everyone. हो सकता है सबके साथ ना भी हो, लेकिन I have seen. We can see the very good effect, because when we do this, there are many areas. We have brainstem, medulla oblongata. We have the entire connection of the head and the neck here only. Okay, it's a wonderful. So this is a technique number one. We are doing what to do for low BP, that I will tell you in the next class. So I hope in this course, number one, we will go very slowly, because my aim is just not to complete the syllabus. My aim is practical implementation. Okay. So if you have any query, you can ask in the group, or you have any query, you can ask right now. Anyone having any question? So thank you so much, everyone. Let's close the session and see you tomorrow. अब हम मिलेंगे कल 8:15 पर मिलेंगे. ठीक है? Thank you. Let's close now.